that is really a no-brainer. But I want to ask you about that. Now, a lot of the people who are watching this, right, and we have surveyed this, HODs has surveyed this, like the number one reason that people, before they get into HODs, when they are just looking at HODs, the number one reason they are looking at HODs is financial, because their reimbursements are very low. And we know that nationwide reimbursement in physical therapy is somewhere between 8 to 12%. That's nationwide, according to data from PPSA/PTA. So without asking you specifics about you and your practice, if the nationwide reimbursement is, let's say, somewhere 8 to 12%, somebody who joins, let's say, HODs and puts really the time and effort and applies the program as it is intended to be, what overall would be, in whatever terms you want, you can describe it, but what would be the overall, let's say, financial benefit that someone will get? I'm not asking for numbers specifically, but what would be the overall financial benefit? Would the profit margins increase? Would the revenue increase? What are the other areas where this person will realize a financial benefit and financial security for the practice?
You know, and I know that in talking in these terms, it's going to vary from practice to practice, but I can just speak in terms of our practice. Our goal as we sat down at the beginning of 2019 was, we recognized that we had gone down, I want to say 6% in our profit margin in the previous year. And we had not really gone down in number of visits. In fact, we had gone up, right? And so I think this is a common story for most PTs out there. I'm doing more and getting paid less.
Because the reimbursement went down.
Yes, yeah. And so what we decided is that per unit of time, our best reimbursing activity is diagnostics, hands down. And so our next goal then became, so we've got 3 clinics right now, or just opening our 4th. And so when we looked at this, our prior model, what I would say kind of our phase 1 model, which had helped to get us started into diagnostics in the first place, was let's have just a few key people get good at this, and maybe that's good. And what we recognized is that the more knowledge that PTs have on an individual basis as a practitioner in diagnostics, whether it be EMG or ultrasound, the more they're going to use that for their patients. We knew this was true. And the more that they use it for their patients, the more that the quality of what we give to the patient goes way up, and our reimbursements go up. So what we did is we said we want 100% of all of our PTs to be really attain that FMSK certification. And we want that to happen within 2 years, which means this year we need a whole lot more of our PTs trained. And now we have more of an internal mentorship follow-up because of the longevity that we've had with ultrasound and EMG here in our clinic. And so now it's really just snowballed. So when we talk about what does that mean to our practice financially, our intention, and I'll just throw this number out there because I think it's helpful for people to hear. Usually if we say, hey, we're going to open another practice, this is how we're going to beat decreasing reimbursements, is we're just going to go volume, 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 and got to open another practice. For us in Idaho, that may cost us somewhere between $200,000 to $300,000, depending on what we're investing to do a de novo startup. Okay, and I think that's fair depending on if you're doing a really good job with your equipment and space and what that looks like. Our goal was not necessarily to do that, not to add more brick and mortar, but how could we achieve not that deficit of $200,000 to $300,000, but how can we increase it to $200,000 to $300,000 in gross revenue without increasing our overhead? And diagnostics was it. Now, I have to tell you, in the amount of patients that our particular practices see that are peripheral joint injuries, it really made sense to put our focus on ultrasound first. Now, we do quite a bit of EMG, and you'll get me talking about that, Dimi, and we'll never stop. But I do just have to tell you, our goal was to get 7 practitioners doing a minimum of 5 5 musculoskeletal ultrasounds a week. We knew they had the caseload to make that medically necessary. We're not asking anybody to do anything that is not correct for the patient. and that the gross profit or gross revenue, I should say, for the year would be an additional $360,000.
Wow, awesome. That's very good. That's very good.